All right, guys, welcome back to Underground Science. In this video, we'll be talking about wide split S2 heart sound. All right, so let's go ahead and get started. So, when we're talking about heart sounds, right, there's going to be four main types that we have to know. One is going to be physiological splitting, okay? The next one's going to be wide splitting, which is what we'll do in this video, what we'll cover in this video. And the next heart sound is going to be fixed split S2, and the other heart sound is going to be paradoxical split S2. Okay, and this is all splitting of the S2 heart sound, right? So if we just quickly talk about heart sounds real quick, like what is S1 and S2, then we'll have a good idea, and then we'll go right into wide splitting of the S2, all right, and the causes for that. Okay, so let's go and get started. So what is S1 and S2, right? So when you have heart sounds, we already know that it's the lub dub that makes up the heart sounds, right? So we have the lub and we have the dub, right? So it's lub dub, lub dub, lub dub. Those are the heart sounds. But we can further divide that into, or we can further go into that and see what lub and dub are, right? So lub is your S1 heart sound, dub is your S2 heart sound, right? And so what makes up the S1 and S2. So if we scroll down here, I tried to draw a picture of the heart. Um, if we circle these valves here, right? So this valve right here and this valve right here are your tricuspid valve and mitral valve, respectively, okay? So this is going to be your tricuspid valve, and this is going to be your mitral valve. And when your ventricles contract, okay? When your ventricles contract, so when your right ventricle contracts, it's going to push blood into the pulmonary artery, right? And when your left ventricle contracts, it's going to push blood into the aorta. When your ventricles contract, you don't want your tricuspid valve to stay open or your mitral valve to stay open, right? Because for right now, let's just follow the right ventricle. Okay, so we're in the right ventricle, it contracts, right? If your tricuspid valve stays open, then blood will go back to your right atrium, which is not what we want. We want the blood to go to the pulmonary artery so that it can go to your lungs and get oxygenated, right? So you would want your tricuspid valve to close. Same thing for your left ventricle. When your left ventricle contracts into and pushes blood into the aorta, you want your mitral valve to close, right? So you don't want regurgitation of blood backwards because that just means you're getting less blood forward, right? You're pushing less blood forward, which is not good, right? So when we're talking about the closure, now that we understand, right, what the tricuspid valve and mitral valve are and why they close, right? They close because you don't want regurgitation. So when these two valves close, right, because the left and right ventricle, they contract together. So when they both contract at the same time, right, your tricuspid valve and your mitral valve close, right, at the same time. So that makes up your S1 sound. So that's your lub sound of your heart sounds, right? So that's your S1. Then you're probably wondering, okay, well, what makes the S2 sound, right? So the S2 sound is when your aortic valve and your pulmonary valve close, right? So if we look here, right now we're in the right ventricle. Let's just follow from the right ventricle, right? So your right ventricle contracts, your tricuspid valve closes. That's going to be your S1, right? And if we see the same thing here, your left ventricle contracts, your mitral valve closes, right? The closure of your tricuspid valve plus mitral valve is S1, all right? So now the blood is in your pulmonary artery and the blood is in your aorta, right? Now, once your ventricles contract and the blood is pushed forward, you don't want this blood, right? Let's do a different color. You don't want this blood coming backwards, right? Because that defeats the whole purpose, right? You don't want this blood coming backwards. So what stops it from coming backwards? Your pulmonary valve and your aortic valve, okay? They have to snap shut now, right? Once your ventricles contract, your pulmonary valve and your aortic valve need to snap shut. Now, when your pulmonary valve and your aortic valve snap shut, that is your S2 sound, okay? So those are your heart sounds, S1 and S2. And we know how these sounds form based on what valves that close, right? So now that we know that, let's talk about wide splitting of the S2. All right, so we said what two valves close? What two valves make up the closure of which two valves make up the S2's heart sound? We said that was the pulmonary valve and the aortic valve, right? So it turns out you can further divide S2 into a P2 component and an A2 component. The P2 component being the pulmonary valve closing, and the A2 component being the aortic valve closing. All right. So if we try to draw it out, right? Let's say this is time, okay? And we drew out S1, right? And then S2, but we just said we can further divide S2 into the pulmonary valve component and aortic valve component, right? So what we're actually going to do is draw it out like this. S1 and then S2, we're going to have the A2 component and the P2 component. And notice, right, if the x-axis is like time, let's say, notice how I drew the A2 earlier than the P2, okay? And we're going to talk about this right now, actually. So usually, right, physiologically, what happens, so normally, when you take a deep breath in, right, so when you inspire, right, during inspiration, what happens? Your thoracic pressure, right? What happens to your intrathoracic pressure when you take a deep breath in? When you expand your lungs, you increase the volume, right? And based on pressure, right? The physics of pressure, we know that in high volume states, you have low pressure. So if you have low pressure in your thoracic wall, right, in your lungs, and in your thoracic wall, right, then that means that will act like a vacuum, right? So if you take a huge breath in, right, and if that decreases the pressure in your thoracic wall, more blood will want to rush there, right? Because now you now created a low pressure environment in your chest wall when you took a breath in. So more blood will rush there specifically to your heart, right? And so if we looked at the heart, right, just a rough sketch of the heart, let's say this is your right atrium, right ventricle, left atrium, and left ventricle. And we said that when you take a deep breath in, more blood will rush to the right side of your heart, right? So that means on inspiration, you actually increase your preload, right? The amount of blood coming to the heart, specifically the right side of the heart. And so that would mean then that the right ventricle will have to pump out more blood across your pulmonary valve, right? Into your pulmonary artery on inspiration. If your right ventricle has to pump more blood, right, it's going to take longer to pump that increased amount of blood across your pulmonary valve, which means your pulmonary valve will now close at a later time. Okay, so when you take a deep breath in, more blood comes to the right side of your heart, which means your right ventricle is now accompanying more volume of blood than usual. If your right ventricle has more blood than usual, it's going to take a longer amount of time to pump that blood, that increased amount of blood, through your pulmonary valve and into your pulmonary artery, which means it's going to take more time now for your pulmonary valve to close. Okay, so that means if we drew that S1 and S2 graph, right, in two different phases, we said inspiration and expiration, okay? And so let's just underline this. So inspiration, right? We said that, let's draw our S1, okay? And then on S2, what did we say? right? We said your right ventricle pumps more blood on inspiration through your pulmonary valve, which means your pulmonary valve will close later now. Okay, so if we drew S2, right? Let's draw S2, but remember S2 is split into A2 and P2. If the pulmonary valve closes much later now, then where would P2 be if the x-axis is time, right? P2 would be way over here to the right, right? Over here. And then A2 would be over here. And then now you breathe out, then everything goes back to normal, right? When you breathe out, more blood rushes to the left side of your heart, less blood rushes to the right side of your heart. So your pulmonary valve does not take much longer to close. Your right ventricle doesn't take that long to pump that blood across the pulmonary valve into the pulmonary artery. So then you see a normal graph, right? So this is actually physiological splitting. We're not even on wide splitting yet, right? So that's S1. And then normally you would have A2 and P2, right, together. Now, why does you might be wondering, like, why does your aortic valve, or why does the A2 component come before the P2 component? And that's because your left ventricle pumps at a much higher pressure, right? It's a high pressure system compared to the right ventricle. So if your left ventricle is pumping at a really high pressure and pumping all that blood across your aortic valve really fast, right? So it makes sense that your aortic valve would close quicker, right? And much before when compared to your pulmonary valve, right? So this right here that we just saw, that on inspiration, P2 comes much after A2, and expiration, they both come basically at the same time. This right here is physiological splitting, okay? Now, wide splitting builds on this, okay? Because what wide splitting is just take this P2 component, shift it way over there, and take this P2 component, even on expiration, and still shift it way over there. But on inspiration, your P2 comes much after your A2, right? And why would that be? Well, the number one cause, right, that we should talk about is a right bundle branch block. Now, remember, when we talk about the electrical system in our heart, so let's draw the heart over here and talk about the electrical system, okay? Just real quick. Um, so you have your SA node here, right? AV node somewhere here, and then your bundle of His, right bundle branch, left bundle branch, and then your Purkinje fibers, right? And so in a right bundle branch block, right, for whatever reason, let's say there's deposits or there's your right um, there's deposits, or you had an infarction where it knocked out your right bundle branch, or you have some sort of stretching going on like cardiomyopathy that destroyed your right bundle branch. Whatever the reason, your right bundle branch does not work properly. So if it does not work properly, then your signals that are required, right, to travel down your right bundle branch and tell your myocardium of your right ventricle to contract and push blood forward to your pulmonary artery, that whole system will be delayed, right? So right there, the P2, it makes sense that the P2 will come after the A2, right? Because if your right ventricle is now delayed and it contracts much slower and much later than usual, then it makes sense that your pulmonary valve now will close much later than usual because your right ventricle is contracting much later than usual, right? But on top of that, if you throw an inspiration to the mix, now because of what we already talked about in physiological splitting, right? If you throw an inspiration to the mix, more blood rushes to the right side of your heart on inspiration, which means what? Your pulmonary valve will be even more delayed now in terms of closing, right? Because now your right ventricle has to pump much more volume of blood out. It's going to take even longer to pump that blood out across your pulmonary valve. So your pulmonary valve will close much more later now. Okay, so everything is just shifted severely, okay? So again, if you looked at the x-axis, right, for time, and we drew our S1 and then S2, right, on inspiration will be split. So we'll have A2 here, and then P2 will be like way over here, right? Because of a right bundle branch block, a bundle branch block. what else can be a cause? What if you had pulmonary hypertension, right? So, for example, if someone had COPD and they had they all their um, arterioles were constricted, right? Or a lot of their arterioles were constricted in their lungs, that would cause a lot of backflow and increase the pressure it takes for your right ventricle to pump blood into your lungs, right? So if someone had pulmonary hypertension, right? So let's draw the heart like this. And then we know that the right ventricle pumps blood into the pulmonary artery, right? So let's say it's a pulmonary artery. But let's say for some reason, right? Let's say you have a pulmonary embolism here, or you have, for whatever reason, your pulmonary artery is restricted, right? You have restricted flow, it's clamped down, it's vasoconstricted. Then that means your right ventricle would have to would have to work much more harder, right? Much harder to pump blood into your pulmonary artery. If it has to work much harder to pump blood into your pulmonary artery, it's going to take more time, right, to pump all its blood across the pulmonary valve. Again, that means your pulmonary valve will close later then, right? So that's another cause. So let's just write the causes quickly over here. So the first one we said was right bundle branch block. And the second we said could be pulmonary hypertension, right? And another cause that we could talk about that could make that makes sense, right? Would be pulmonary stenosis. So what if for some reason, right, for whatever reason, your pulmonary valve here was had a lot of fibrosis, right, and it was very stiff, and it did not want to open and let the blood flow across it, right, for whatever reason. If that happens, then again, your right ventricle is going to have to work really hard to get blood through that stiff pulmonary valve, which means it's going to take much more time for the right ventricle to pump blood across that stiff pulmonary valve, which means the pulmonary valve will close much later, right? So again, that makes sense too. Okay. So these are the causes for wide splitting S2, and this is what wide splitting S2 is, right? So this is going to be for inspiration, and on expiration, we're going to see the same thing, except P2 will be a little closer to A2 this time, but it'll still be split. Okay, so you'll see A2 here, right? And then P2 will be like right here, but it'll still be split. You still had that splitting of that S2 heart sound. Okay, so you'll hear that double split sound on inspiration when you're auscultating heart sounds in the left upper sternal border, right? Um, so yeah, that's basically it. This is going to be wide splitting S2, right? Wide splitting of your S2 heart sound. I hope this video made sense. And I hope to see you guys in my future videos.